Lymphoma, otherwise known as lymphatic cancer, is categorized into two distinct categories, non-Hodgkin's lymphoma and Hodgkin's lymphoma. Although a rare cancer, it is still important to recognize the warning signs because early detection could save you or a loved one's life.
What is lymphoma cancer? Lymphoma cancer is the cancer of the lymphatic system. It is a type of cancer that affects white blood cells. White blood cells grow and multiply uncontrollably and don't die off properly, causing lumps of abnormal cells to form called lymphomas. They are most commonly formed in the lymph nodes but can occur in the thymus gland, bone marrow, or the spleen. Lymphoma is one of the most common cancers in the U.S. ACS predicts that 72,580 people will get diagnosed in 2016. About 20,150 people will die from this cancer in 2016. Death rates have decreased since the 1990s and will continue. The average American's risk of developing this cancer during his or her lifetime is about 1 in 50.
The exact cause for lymphoma remains unknown. However, there are factors that can increase your risk, such as older age, male, having a previous autoimmune disease, HIV and AIDS, a diet high in meats and fish, and exposure to certain pesticides.
Because there is not much known regarding the cause of lymphoma, it is currently not preventable. However, it is important to pay attention to the warning signs because early detection is key to effective treatment.
Some of the symptoms for lymphoma may include swollen lymph nodes, fever, muscle weakness, fatigue, rapid weight loss, sweating, difficulty breathing or chest pain, and itchy skin or rash. There is no widely recommended screening test for diagnosing lymphoma. However, other tests can be used, such as tissue biopsy, blood tests, CT or PET scan, bone marrow biopsy, and X-ray or an ultrasound. When assessing the progression of the lymphatic cancer, it can be categorized into 4 different stages. Stage 1 includes 1 lymph node area. Stage 2 includes 2 or more lymph node areas on the same side of the diaphragm. Stage 3 includes 2 or more lymph node areas on both sides of the diaphragm. And in stage 4, it has spread to other areas outside of the lymphatic system.
Treatment options and recommendations depend on several factors, including the type of lymphoma and the stage, possible side effects, and the patient's preference and overall health. Options are chemotherapy, radiation therapy, or immunology, often all combined or beneficial.
There are a lot of unanswered questions about lymphoma, and research is taking place at universities and hospitals across the country, and even the world, in areas such as genetic contributions and environmental influences. Research in drug therapies, as well as other treatment options, are being explored as well. Due to lymphoma having many unknowns, there are clinical trials for possible treatments happening all over the United States, including ones for several new drug treatments in Philadelphia, PA at various institutions, as well at H. Lee Moffitt Cancer Center in Tampa, Florida. If you're interested in participating in one, and to see if you qualify, visit www.clinicaltrials.gov.